So that includes joint replacement surgery as well as patients who require sports-related surgery, or if they have a fracture, they can come here to have their fracture taken care of.
So I'm hearing so much more about hip or knee replacement lately. Why do you suppose these procedures are catching so much buzz?
There's been a lot of advances in the technology of these procedures, so they're more successful. And as they get more successful, more patients are telling their friends, I had a great result, and I've gone back to dancing or to skating, and I think that this moves the whole level more into the public eye.
So would you mind taking me through the process then, what a patient would experience during one of these procedures?
Sure. The first step is meeting with your orthopedic surgeon and deciding what operation is appropriate for you. And then basically at Mercy we have education classes in which the patient and their family can learn about not only the evaluation of the patient, the hospital care, the procedure itself, but also very importantly what's going to happen at home. And so what needs to be prepared at home, what it's going to be like to go home after the hospital, what the hospital stay is going to be like, physical therapy during the hospital stay, and physical therapy at home afterwards. So just simple things such as getting in and out of a car, what's going to be different about that in the early post-operative period.
All right, well, I had the opportunity to witness one of your VNA home care therapy sessions today, and I have to say that that's a really nice opportunity for your patients.
It certainly is. It's very helpful for the patient to be in their own environment, and so having the visiting nurse or the physical therapist come to the home is a great plus for the patient in this time frame.
Joe, it seems to me that you play a really unique role when it comes to orthopedic recovery. Do you mind sharing a little bit about what you do?
Sure. Well, Mercy, first off, the Fort River does such a great job in making people feel safe and secure and well cared for while they're going through their recovery from the surgery. So when they come home, all of a sudden, that's like the great unknown. So we come in, we bridge that transition to home, and we come in and we help people begin to be able to walk safely around their own home, continue on with their exercises, help facilitate safety and independence with bathing, dressing, meal prep, housekeeping, all those activities that they're eager to get back to.
Well, thank you for allowing me to watch you today. I've been watching you in action, and it seems that you work very closely with your patients, and you must form some pretty tight relationships. Do you think that these relationships help with the recovery process?
Absolutely. The minute you walk into somebody's house, you have to develop a level of trust with them. They're allowing you into their home, and they're recovering. Initially it's a painful process, and to be able to trust you to exercise them when they feel like just sitting on their couch and moving around their home, you definitely form a bond. And hopefully that's something that lasts. We see people in the community afterwards, and they remember us, and that's just a wonderful thing about doing home health care.
Is there a typical recovery time for these procedures?
It varies. I really think the best thing that people can do for themselves to prepare for their surgery is to do Mercy's preoperative joint program. We find that those people by far do the best when they get home.
All right, well, Joe, you've been doing this for a number of years. So in your opinion, what do you see as the primary benefit of home care therapy?
Well, I think when you go home, you don't have those therapists like you do in the hospital, just coming into your room and having you do your exercises. So there is a tendency when you get home just to kind of convalesce and relax and maybe slack off a bit. So we come in and we just keep that recovery process going. It's important to have a cheerleader there and somebody to move you forward, because our goal is to help a patient get to complete recovery. And in fact, optimally, we want them to have a higher level of function and activity level than they had prior to surgery.
It seems like comfort is really important to Mercy and this institute. It seems like you have it really well covered, to the point where you've done away with Johnnies even.
We have. The patients like having a t-shirt and shorts as opposed to the old Johnny, and they like having the rooms to themselves, so everybody's in their own room. They have a great view from any of the rooms around, and you can see that it's an open environment. It's very light and airy.
And this practice is really all about being active, being able to dance with your spouse or swing a golf club or go for a walk.
Sure, whether it's a total ankle replacement or whether it's a finger replacement or a hip or a knee replacement or even a shoulder replacement, all of these procedures is designed to get the patient back to an active lifestyle that they enjoyed at one time.
Mercy's dedicated orthopedic team specializes in providing leading technologies in care involving the musculoskeletal system. These procedures include joint replacement surgery, orthopedic spine procedures, foot and ankle surgery, sports medicine procedures, fracture care, hand, elbow, and shoulder surgery, arthroscopic procedures, and comprehensive foot and ankle care.
I was having lots of pain in my hip, and it was very difficult to go for long walks with the dog, difficult going upstairs, and I knew it was time to have it checked and see what they would do. They were very, very friendly here at the Orthopedic Institute. They put me at ease. They were very friendly, very talkative, keeping you nice and calm. It was the most relaxed experience going into the OR that I've experienced.
When we think about medical advances, we typically think just about the treatment of the patient, but the care given to the patient's family is an equal part of the equation, and there's no better care available than what you'll find right here at Gary's House.
Gary's House first opened its doors here in Portland in December of 1988 as a hospitality home for patient families who have a loved one who's ill in any Portland area hospital. We have 9 beautifully appointed guest rooms for our families. In those guest rooms, we include a TV, a clock radio, and a telephone. We have beautiful common areas such as this living room, dining room, and a fully stocked kitchen. We also have a new elevator that will take guests from the first floor to our second floor bedrooms for those with mobility issues. We provide here at Gary's House a peaceful respite and a safe, comfortable setting for those who have been dealing with a lot of medical burdens in the hospitals, and we try to give them anything that they need to help make their stay comfortable and relaxing. We are so excited to be a program of Mercy Hospital, and we are truly grateful for the support that we receive from all of our local business community members as well as individuals here in Maine and across the country. And we are just so happy to be able to be a resource for families here in the greater Portland area when their loved one is receiving treatment and they don't have to worry about where they're going to stay and where they can take a rest.
Did you know that if you are a patient at Mercy Hospital, you can order from our restaurant-style room service menu? The menu is in your room. You just simply pick it up. You and your family are welcome to call, talk to one of our attendants. We'll produce your food from local ingredients. You can order anytime during the day if you just require a snack or you're hungry for a full meal. Or if you have any dietary restrictions, we can accommodate those as well. We'd love to serve you.
Diagnostic advances in women's healthcare have made leaps and bounds over the past decade, and there is no area where this is more evident than in women's imaging.
One of the biggest advances we've had in the recent past is the digital mammography. What that's allowed us to do is see through the very dense breast tissue and see the entire breast all the way from the skin surface to the deepest aspects. Stereotactic biopsy allows us to locate precisely where in the breast we need to perform a biopsy. We do that by taking mammogram type films at different angles so that we can determine the depth in the breast and right where we need to go. We've made great advances in women's breast imaging and also in bone mineral density determination, and that has done a great deal to help patients detect their abnormalities earlier so that they can then get the appropriate treatment as needed. What we've been striving for is to try and get patients to come in to get their screening studies so that we can do what we can to get them on the right treatment as soon as possible.
Let's face it, women and men are not cut from the same cloth, and their health care shouldn't be either. Mercy understands this and is proud to offer All About Women and the Birthplace, unique opportunities for women and their health.
All About Women and the Birthplace are members of the Mercy family that specialize in comprehensive women's health care from adolescence up through menopause.
Dr. Whiteley, All About Women is such a perfect name for this practice. Why do you think Mercy is putting such a strong emphasis on women's health care?
I think Mercy has come to realize that women's health care is a unique part of health care. The Birthplace is a large draw for the hospital, and adding a women's health care practice to the family, I think has only served to enhance that reputation and provide an extra avenue of women's health care that previously didn't exist. I think they realize that it was needed and that the time had come.
Well, what types of services then can a patient find at All About Women?
We run the gamut. We start with adolescence up through menopause. We do